All right, now for Should I Worry? It's our weekly segment about everything that worries us. So this viewer is asking, I'm a 62-year-old man, and I've recently been diagnosed with nuclear cataracts. I'm otherwise in reasonably good health. My doctor recommends surgery, but what are the risks? Dr. Samadi, nuclear cataracts, first of all, what's that? How do you even know if you have it? And should this gentleman get surgery?
Yes, great question. What is cataract? Cataract is basically when the lens in your eyes, which is exactly like the camera, when it gets cloudy, the lens in the eye is made out of water and protein, and as we age, and he's 62-year-old, so as we get older, that becomes a little clump of protein, and it can become cloudy. So what happens? You see the colors, and they're kind of dull. They're not really, and the window is not so clean. At night, you know, the lights are getting too glary. That's cataract. There are many different types. One of them is nuclear one. That means in the core, in the center core of the lens is where that clumping is. If it's on the posterior, it's called subcapsular, and there is another type. So in this particular case, most likely is as a result of aging. Sometimes prolonged steroids can do this, diabetes, smoking. We just talked about UV light. Any kind of eye injury can do this, and family history can also increase the risk of cataract. I think in the hands of an experienced ophthalmologist who does a lot of these procedures, you have over 95 to 98% cure for this cataract. These are fairly safe operations. It's not very costly, and it doesn't take very long.
Do they do it via like a laser surgery, or?
What they do is they basically like take the old lens out, and they would put in a clear plastic intraocular lens. It's a brand new lens, and you can see better. There are some complications. I don't know if you want to talk about it now, but there's always inflammation, infection. There's also posterior capsular opacity, where what happens is when you take the lens out, you leave the capsule behind, and sometimes that capsule can become hazy in 20%, so you have to use a laser to fix it. But those are very rare. I think you should go ahead and fix it, because over time it can get worse.
You know, Mark, I went to my eye doctor, and I'm seeing okay. Everything's fine after 3 or 4 years. Like, what are you kidding me? Coming once every 3 or 4 years, you got to go in once a year just to check this type of stuff.
And glaucoma, which we'll talk about at another time. But really, it's because 50% of people over the age of 80 have either had their cataracts out or have severe cataracts. Steroids can lead to cataracts if you're on prednisone for a while, or if you have diabetes, or just plain aging, or that sunburns we were talking about early in the show can lead to it. If you start to have dim vision, if you start to see cloudy, if you're seeing halos, if you're having trouble seeing at night, if you have sensitivity to glare, this all can be cataract. Now, we take out a cataract minimally invasively. They put in a probe, they fracture the cataract, and then they suck it out. They suck it out, literally. That's a very simple procedure. It takes about 15 minutes. We're also, as David mentioned, doing it with laser. Minimal problems with this. Can be an infection, can be bleeding. I mean, look, I got to think twice before I send somebody on Coumadin or blood thinners for cataract removals. I got to clear everybody, Eric, that goes for an operation, even a simple cataract operation. I want to know your blood pressure is under control. I want to know that you're not bleeding from somewhere, or you don't have a risk of infection, or you don't have diabetes not under control. All those things. See your internist, get cleared, and then it's a very simple procedure.
And check your go to the eye doctor if you have an eye doctor, at least once a year.
Absolutely.
But Eric, you can also change your diet and add a lot of leafy vegetables. You can add things like spinach and other things that has antioxidant. You can reduce meat. There has been studies done about this. You want to be careful about that.
He's like, forget about it. I'm going to have my meat.
For cataracts, really?
Fruit and vegetables.
A lot of antioxidant can help you.
And no prolonged steroids.
Zeaxanthin.
No prednisone for a long time.
And by the way, Eric has made me wear also the same glasses as Eric, so we look alike now. This is because of Eric.
Let's get a discount.